Hello and welcome. Let's talk about skin graft and flaps. So, what does it mean by skin graft? Skin grafts are tissues that are transferred without their blood supply, which therefore have to devascularize once they are in a new site. Types of skin graft. According to procedure, it is split thickness skin graft or thirst graft, and there is full thickness skin graft or Wolfe grafts. The split thickness skin graft are used to cover all sizes of wound and are of limited durability and will contract. It consists of full epidermis and part of the dermis. It may be thin, intermediate or thick. The full thickness skin graft is used for smaller areas of the skin replacement where good elastic skin that will not contract is required, such as fingers, eyelids and facial parts. And the other type is the composite skin graft, nerve grafts and tendon grafts. Now, indications of skin graft: whole granulated ulcer, clean wound or defect which cannot be approached after surgery to cover the or closing the defect treated, extensive wound or trauma. Example: after wide excision in malignancy, after mastectomy, after wide excision in squamous cell carcinoma, and to cover burn wound. Stages of graft: there is a stage of plasmatic imbibition, stage of inosculation, and stage of neovascularization. The ideal character of the recipient site of the skin graft includes adequate vascularity, should be present in the recipient bed, healthy granulating area, and beta hemolytic streptococci load less than 10 to the power 5 per gram of tissue should be there. Otherwise, graft failure will occur. Now, complications. Complications includes contracture of graft, seroma and hematoma formation, infection, loss of hair growth, blunting of sensation, dry scaling of skin due to non-functioning of sebaceous glands, and graft failure. Now, split thickness or thirst graft. These are used to cover all sizes of wound and are of limited durability and will contract. The graft site regrows from epithelium around the adnexia and the missing all the greater areas to be covered. The contraindications include overexposed bone without periosteum, overexposed tendon without paratendon, infected wound, and less blood supply. Now, flaps. Flaps are tissues that are transferred with intact blood supply. The types include random flaps, axial flaps, pedicled or isolated flaps, free flaps, composite flaps, and perforator flaps. Now, another classification of flaps include local flaps, combined local flaps, distant flaps, microsurgery and perforator flaps, and combined flaps. The local flaps includes transposition flap, jet plus T, rhomboid flap, rotation flap, advancement flap, B2 wide advancement, BaileyLove flap, and bipedicle flap. Combined local flaps include W plus T, the multiple Y2B plus T. Distant flaps include mycutaneous flaps, fascicutaneous flap, and combined flaps include conjoint flap and chimeric flap. End of the topic.